Good morning. Good morning, guys. Sounds like it's a good day today. It's Friday morning. It's been a nice week so far. Remember, my name is Richard Ogachi, and this is my channel, my YouTube channel. I'm here to share experiences and also I'm a registered nurse. I moved to the United States. I live in the United States of America, and I practice as a registered nurse. And we've had different kind of experiences. So this podcast is based on sharing stories about practicing healthcare and making impact, showing different kind of health solutions, where stories meet solutions. And then again where preparedness meets opportunities. In this platform, I'll be doing interviews with in-person interviews with different kind of healthcare professionals, medical doctors, registered nurses, physical therapists, all kinds of cadre in healthcare. And my initial episodes and videos were based on appreciating the United States of America citizens based on the help that has been given out for the US aid. So, as I've said, it's going to be actually where frontline experiences meet global conversations, and where nursing goes beyond just care, goes beyond bedside care, and also like making it wholesome, where different kind of health workers, you go beyond your means to give care, because I understand that you can never pay a healthcare worker enough, but at least it's kind of a field that is quite sensitive, and it's never always about money, but it's about money anyway. But having to have health workers who are taking personal initiative to give help and take care of patients in a way that is humanly, and which is good healthcare, and then making a big difference in terms of meeting personal patient needs. We are looking at going beyond what you're supposed to do, because I know that sometimes it's difficult. Sometimes conditions are not favorable, especially when you're working on in resource trained setups where you don't have enough to be as at your best as a registered nurse. It usually poses different kind of safety issues. But at this point in time, I know that we can become better. We can do better. We can always go out of our way to give help or provide care. We can go out of our ways to become the best in healthcare and give help where help is needed. But in this particular sharing of stories, we will be like sharing open experiences with the patients. We know that sometimes, most of the patients in hospitals, you are in pain, they are really needing help. Most of them, because of the disease processes, they are exhibiting symptoms of or signs, like, for example, if it's a patient who is having dementia issues, forgetfulness, you know how difficult that is. You know how hard it is to redirect, and sometimes when there is sundowning, there are different kind of situations that pose significant challenges in provision of care. But health workers all over the world, you know how that is difficult. But I know that as that goes, because also there is this narrative that it's too much in healthcare. It's emotionally, psychologically experiences that are really not good. So you want to leave. You may want to have that plan, or you may want to exit, but you know what? We still need health workers. Those who are already like in the game, those who are ready to go out of their way and provide care, those who are always putting in the hours, 12 hours, grinding 12-hour shifts, long hours, long days, long nights. And then you meet maybe a difficult patient, maybe a patient who is, overwhelming to take care of. I know that usually happens all the time. But you know what? There's always hope that anyway, whatever happens, you have what it takes to take care of these patients. You have what it takes to go out of your way. You have what it takes to be there, be quiet and listen and give them time, whatever happens. But you see, the ultimate effect or impact, the big difference is when this patient leaves the hospital and goes home, it's always a joy. It's always celebration. It's always standing ovations being given. It's always like you feel like, okay, I was able to be there for this patient. I was able to give the right care. I was able to go out of my way. I know they needed me at that time. The patients needed me at that time, and they needed care at that time, and you are able to do it. And it's a great joy to go out and say, okay, I did what I was supposed to do. Remember, it doesn't always have to be like, okay, this is too much for me. It's always too much psychologically and emotionally, but you can always get your way. You can always get what you want. You can always navigate through the system and navigate through the situations. Every day you focus on the 12-hour shift. Be all you can be. Do all you can be. Because people need you to be there for them. People need you to be there for them all the time. People need care, especially when you're going through a disease process, as you're going through a difficult time. You've been given a chronic diagnosis or maybe a terminal illness, or you've been given you've been told that you have this amount of time to live, It always takes a good nurse and a good healthcare provider to help the patient to navigate through that situation. You never decide or never know what you're going to face. You never know what you are going to go through, but at a given time, I've seen a lot of people who come to the hospital, the surprises are all over the place. Like, you get to be told that, you know what, you can't go back home because you need a medical hospital admission because of your condition. Nobody likes that. No one likes to stay in the hospital. It's always very depressing. It always causes anxiety. But it always 50% done when you meet the right registered nurse, when you meet the right doctor, when you meet the right physical therapist, when you meet the right lab person, when you meet that person who is in the front hospital to welcome you and to say that this is where you get the help that you need, to give you a reassurance that things are going to get better, to give you an insight that things are going to make sense in the end. As you go through, you know what? We pray and hope that you get behind this, that this may not break you, that this is going to get behind you. It's never always easy, but as a registered nurse, it's always good to be there for this kind of patients. It's always to give the care where care is needed. It's always to be there and show empathy, put yourself in their shoe, and try to help. I have worked with great nurses, by the way. I've really worked with good people who know how to do it. I've had to learn from some of the registered nurses who was far much younger than me, and they've been there for me. They've shown me some of the things and some of the best practices, and it has always been good. And I've really had to work on myself as a registered nurse, I've had to like adjust to the new environment and practice and be effective and be there for this kind of patient. So guys, this is my channel. My name is Richard Areba. I'm a registered nurse, again, sharing stories and giving my personal experience moving from Africa, moving from Kenya to the United States of America as a registered nurse, as post specific different kind of challenges, but I'm always almost there. But it has taken support by people who I work with. I work with very good colleagues. It has taken support from my wife, and here I am now. And I can say that at least I'm like 90% settled now, and I'll be able to be all I can be in this healthcare profession and be there for the patients, be there for people who need me, be there for people who need healthcare and people who are distressed because they've been diagnosed with maybe a terminal illness, and maybe they've been told that they have no time to live. But you know what? All this, we just pray that whatever you face, just get grace and the power and the energy from the Lord to handle, so that it doesn't break you. God bless you. See you next time. This is Richard Ogachi, and this is my channel. Please just hit the subscribe button, and let's keep sharing these stories. God bless you.